this session. We will be posting it on the Extension Horses YouTube channel once we're done. So please feel free to share that around with anyone. I'm Dr. Colleen Brady. I'm the horse extension specialist here at Purdue. But I'm going to kind of turn it over to Miranda McGuire. She is the graduate assistant that's been helping with extension programming this fall or this spring. I guess it's spring, even though the weather's supposed to snow this weekend. She'll introduce our presenter. If you do have questions, please go ahead and put them in the chat. We'll be monitoring the chat and we'll either answer your questions or we will ask them of Dr. Farr where appropriate. So I'm going to turn it over to Miranda and let her take it from here.
Awesome, thank you. And welcome everyone to our second webinar of our spring series. And we have Dr. Amanda Farr with us from Purdue University Vet School. And she's going to be talking about vaccines in healthcare for horses. So thank you, Dr. Farr, for joining us tonight. And we can go ahead and get started.
Okay. So tonight we're going to talk about vaccines and healthcare for horses. This is a huge topic because obviously I can do a whole lecture on vaccines and just about every aspect of horse healthcare because I like talking about horses in general. And this is kind of my most favorite thing to do. So we'll get started and see how we can get through this, I guess. If this works. Okay, so what I want to go through tonight is a discussion on vaccination, like what's important, what 4-H is requiring, and why. We're going to talk a little bit about fecal egg counts and deworming and why that's important. And dentistry, which I can do an entire hour on as well, but I won't. But dentistry is really important for the horse. A little bit about Coggins tests, just because that may become an issue or a requirement down the road. And it's important if you are going out of state or for various other reasons. And then like a biosecurity briefing, we'll just do this military style. So kind of a, why do we care about biosecurity? My favorite Eventing Barns first show is at the end of this month, which is hard to believe. I think in 2 weeks. I haven't been on my horse in over a year, so I assure you I will not be going, but that tells me that it's time to discuss biosecurity. And then a little bit about bubble wrapping, because horses like to get hurt. And it'd be really nice if we could come up with some form of bubble wrapping, but just some basic things we can do to keep your horse safe that you can do to avoid seeing your veterinarian when you don't want to. And then a little bit about emergencies. And lastly, and I'm glad Colleen's going to make this available because I put together a list of things that maybe you should have in an emergency kit for down the road. If you put it together, maybe you'll never need it. So let's start with vaccination because that's clearly important and there are requirements for 4-H. So if you have a horse and you're doing 4-H, or really if you just have a horse, you should be doing vaccines. And core vaccines are what we're going to start with. So when we talk about core vaccines, what do we mean? Not the core of an apple, but it kind of goes back to that same concept, right? So the Oxford Dictionary defines core as the central or most important part of something. And when we talk about core vaccines, we're talking about vaccines that protect horses or anything that we're vaccinating from endemic diseases. That means diseases that are in the environment or population. Highly infectious diseases. So if they can be transmitted from one horse to another easily, those are things we're going to want to protect our horses against, or if they're very severe. So if your horse isn't vaccinated and it gets this disease, is it going to die? And obviously we want to protect that. Protecting the public. So we'll talk briefly about rabies vaccination, but because rabies can be spread to humans, we want to think about vaccines that are going to help protect the public that may be walking through the barns or visiting with our horses at the show. We don't have any horses or any vaccines that are required by law in horses currently, but if you've got cats and dogs, you know that you do have to have a rabies vaccine for them. And then the other really important key to core vaccines is these are vaccines that are safe and we know that they are effective. And so when your veterinarian says these are important, or when your 4-H leader says these are important, they are safe, they work, and there's a really good reason we want to get them into your horse. So the first vaccine requirement for 4-H, or the most important in my opinion, is tetanus. This is really just the basic. It started out as, it's available as a single vaccine. It's in a lot of grouped vaccines, and the disease is not very good. It is a bacteria that's present in the soil and in the feces of horses, so they can poop it out, and it doesn't bother them if it's in their GI tract or in their feces. But if they get a little puncture wound or foot abscess, if they step on a nail and that bacteria gets into their body, then they can get tetanus. And horses are really susceptible to it, which seems kind of silly that if they're shedding it into their environment, they're also really likely to get it. And if horses aren't vaccinated, about 80% of horses that get the disease will die, which is terrible. And I'm going to say annual vaccination. So once a year, we really recommend getting a tetanus booster. I'm not going to talk about vaccines for pregnant mares. I'm not going to talk about vaccines for youngsters, so foals and weanlings. If you happen to be blessed with any of those, you should talk to your veterinarian, because there are different schedules. But for tetanus and most of these, it's an annual vaccine. And then this is kind of a sad video, but I have a friend who works in northeastern Indiana in an area that they don't have a lot of people that want to vaccinate. And so this is a foal that got tetanus through an infected belly button or umbilicus. And whoops, this is what they look like. So they're down, they can't walk, they have little seizures, and their third eyelids flip up. And there really isn't anything we can do. Like, no matter how hard most vets try, we lose these guys or we have to put them down. And it's frustrating from a veterinarian standpoint. This is a $15 vaccine. It's not that big of a deal, in my opinion, to put $15 into this vaccine for your horse. And obviously, if you've got a horse that you love and you want to take to 4-H, you don't want stuff like this happening to it. So that's part of the reason tetanus is on this list. Rabies is also on the list. It is not very common in horses, which is great in the United States, but it's transmitted by an animal bite. And so wildlife, bats, anything like that that might bite your horse could give your horse rabies. And then if your horse started acting funny and you stuck your hand in your horse's mouth, it can spread to humans too. So that's another reason rabies is really important. Plus, if we have any people at 4-H that actually want to pat our horse and maybe are silly and stick their hands in our horse's mouth and get bit, we don't want to deal with that. So, and horses that aren't vaccinated against rabies, most of them don't make it. But with a once-a-year vaccine, the vaccine is safe and these guys do great. They don't get rabies if they're vaccinated. And one of the reasons we consider it a core vaccine is, this was sent to me by one of my veterinarian friends who knows I give lots of lectures like this. So what do you guys see here? If I was in person, I'd be taking like little hands, help, answer my questions here. But this is a whole herd of horses. And she came home one day after work to find all of her horses as she drove up against the fence in one spot. And she's got quite a herd there. You can see it's a teaching herd, but which is why they have these straps on. But when she got closer and took a look, what do you see down here? There's a little skunk. And here's a horse nose, and here's a horse nose, and here's a horse nose. And these guys are all coming over to investigate. So if that skunk were sick and the horses were to be nudging it and pestering it and it bit one on the nose, we would want our horses to be vaccinated against rabies so that we don't worry about that. I have a friend whose horse keeps getting sprayed by a skunk. The horse is vaccinated against rabies, but I swear this horse must think these are play toys because she's always washing her horse in tomato juice. So it does happen. It's an issue. And we can't keep all the wild animals out of the pasture. So we just keep our horses safe and protected. So another set of core vaccines are these three vaccines. They protect against Eastern encephalomyelitis, encephalo meaning the head, and myelitis being the spine. So Eastern and Western encephalomyelitis and West Nile, they all affect the brain and the nervous system. And they're spread by mosquitoes or biting flies. So if you've got a sick horse and a mosquito or biting fly bites it, gets some blood, and then goes and bites your horse can get sick with these diseases. And they usually cause neurologic signs. So these guys are wobbly, they can't walk straight, they may fall down, they may have some twitches or tremors, they don't act quite right. And mortality in unvaccinated horses, West Nile is about 33%, but the Eastern encephalitis, which humans can actually get, not from horses, but it's also a human disease, it's up to 90%. But again, we don't see horses get this disease with vaccines on board. They're safe vaccines and they work great. So again, this is an annual vaccination. We do it in the spring so that it's really strong through the whole mosquito season. And this is what we see here at Purdue in the veterinary teaching hospital with horses that get some of these neurologic diseases, is they will come in. Sometimes clients can get them on the trailer and they may fall down on the trailer, or they may actually, we've drug horses onto the trailer using pallets, plywood, that sort of thing. And then we get them into the hospital. We've got these amazing slings. So we work carefully to get this horse completely strapped up in this contraption. And then we've got a hoist in a couple of our stalls. And so once we have the horse hooked up, we can use this hoist in the ceiling and literally lift the horse back up so that it's standing, because it's not really good for horses to stay laying down for a long period of time. But if we can get them upright, and then we can treat them, we can treat their fever, we can treat anything else going on, a lot of times we can get them saved. And that's why the mortality, especially with West Nile, isn't as high. But again, if their horse is vaccinated, they don't come in like this. Like, we just don't see it. It's another great set of vaccines for bad diseases.
So if somebody had to bring a horse in to be treated for encephalitis,
Yeah.
ballpark, what would that cost be? I mean, I know, because that's hospitalization for several days. It's lots of specialized treatment.
It is. And it really depends on how quickly the horse responds. So if it were to be one of these viruses, it's all supportive treatment. So they might get a catheter in and have fluids. They would get medicine, like when you're sick and you take ibuprofen or Tylenol because you have a fever and you don't feel good. So we can give them that, feeding them a good quality food and a lot of time. But it really depends on how well the horse responds, how sick it is. If it's down and it stays down and needs to be slung for a long period of time, usually, Colleen, you're looking at $1,500 to get in, get diagnosed, and maybe have a day or two of treatment. We had a horse come in with botulism, which is a completely different disease, but the owners bought a waterbed and we worked really hard with it, but it was in the hospital for probably 3 weeks. And I think its bill was over $10,000. And unfortunately, without insurance, that's not easy to handle, but I'd say probably somewhere between 3,000 and 6,000 for some of these neurologic horses that need to come in and spend a week in the hospital.
Or you can give them a $15 vaccine.
Or you can give them a $15 vaccine. I mean, really, one of the things, so when I teach the veterinary students, I do a vaccination lecture. And one of the things I push to them is that if you can help your clients understand that, yes, I understand that spending $80 or $100 on vaccines every year for your horse can be a hardship, especially if you have, like, I have 5 horses and too many donkeys. So suddenly I'm spending $700 a year on vaccines, which is a lot. But if any one of these animals got sick and I had to pay $1,500 or $3,000 or $10,000, I don't know how I would do that. And I'd much rather pay $100 and know that they're going to be safe. If that makes sense. Okay. So 4-H currently requires the ones we've just talked about. And then there's 2 more vaccines that 4-H requires that we consider at-risk vaccines because they are spread from horse to horse. So if your horse doesn't ever leave your farm, doesn't share a fence line with any other horses, never sees another horse, and you don't go pet any other horses, and you don't have a farrier come from other horses, and everybody tries to be safe, but some people might say that you don't need this vaccine. I think that every horse should get this. So in my mind, this vaccine is for as well, because what if your horse gets sick and has to come into the vet school? What if it gets a puncture wound or it cuts itself and it has to come in here? You probably want to have this vaccine on board because it might see other horses here in the hospital. So I always think this is funny because this horse is like, oh my goodness, this one's really having a good coughing fit here, spraying some, I don't even know what, nastiness all over. And this other horse is saying, wow, you should really see a vet about that, which I'm not sure any horse ever said, but they do need to see us sometimes. So the two diseases that we see that are primarily respiratory can be prevented by vaccination, and 4-H requires are equine influenza virus and equine rhinopneumonitis, which most people just call rhino because who wants to run around pronouncing rhinopneumonitis all the time? So these are usually called flu and rhino, and they usually come as a grouped vaccine. So you can get just the flu rhino vaccine. They are upper respiratory diseases, so you get snotty noses and coughs, and sometimes you get a little swollen lymph node, and they might run a fever, and they might not want to eat very much, and they feel like you guys do when you have a cold. And they get spread just like, you know, we're supposed to sneeze like this. We can't make our horses do that, but kind of if we sneeze like this and spray it all around, and then everybody else at school gets sick, that's kind of how this spreads. And we really recommend boostering it every 6 to 12 months. So horses that live in boarding facilities or are showing all year round, or I've got a number of clients that are really lucky and they take off to Florida in the winter or Aiken, so where it's nice and warm. And I do vaccines in January for these guys. And then we do vaccines 6 months later to get them through the fall. And that way they are not at risk because they are constantly with other horses. If you have horses that just stay at home and they don't go see other horses, then once a year is probably fine. Or maybe you're a weekend warrior and a spring, summer, fall trail rider, and that's all you do. So you really don't need to see your veterinarian in September or October to get another flu rhino booster. So if you're eating, I'm sorry, I try not to put too gross of pictures in here, but these are the things we look for. Horses that are coughing and we don't know why, but that's a good reason to get your veterinarian out. And then, you know, this, which is not very nice at all and is really disgusting. But snotty noses are part of this disease and a reason to call your veterinarian as well. But that's the last vaccine that's required. So do you guys have any questions or comments at this point about vaccines that you want me to answer before we switch gears and look at dentistry?
Does anybody have a question? We have a small enough group. You can just raise your hand if you have a question.
Okay. If you guys don't know Fergus the horse, this is a Fergus cartoon. I'm pretty sure his owner must actually own a Fergus that acts just like this because she clearly has horses. These come in great cartoon books if you're looking for a Christmas gift for a kid or somebody because they're hilarious. So this is Fergus. He's this kind of sorely looking horse, maybe a chestnut. I'm not really sure what he is. He makes great faces though. And he's got this cute little owner that he really torments. I mean, he does everything possible to make her life miserable, even though I do think he loves her. So she's saying, so the guy came to work on your teeth today, Fergus. And he says, yeah, it was a bit of a tussle. I think there's still something stuck way back in my molars. So way back here, what's back here? She wants to know. And he says, his hat, cell phone, and his right. No, it was his left boot. And I will tell you that even with sedation, I feel like sometimes it is a struggle to get these horses' teeth done. And I'm glad I practice in a time where there's sedation. So just like if you have a mom or dad that's scared of the dentist and they get a little bit of medicine, so when they go to the dentist, they don't get worried about it. We have that with horses. But equine dentistry is a really big deal. And I know this is kind of a busy slide, but just like you guys have to go to the dentist every year, your horse should go to the dentist every year, which means your veterinarian should take a look at your horse's mouth. And this is really important, in part because horses form sharp points. Did you guys know that horses' teeth grow through their entire life? So they're always growing tooth. And then as they're grinding, they're always wearing it down. but because their upper jaw is wider than their lower jaw, as they're grinding like this, they start getting really sharp points that can tear up their cheeks and cause cuts in their mouth and on their tongue. So it's important that we do something with those so they're not painful. We also know that horse teeth can fracture. So I had one a year or two ago that the horse likes to chew rocks and broke a tooth chewing a rock. And we've had some where they've gotten kicked in the side of the mouth and it's broken the tooth. And one bad thing about teeth is if they get infected, their teeth roots can come all the way up into the sinuses. And so they can get a sinus infection or they can drain out down here. So making sure their teeth are healthy is really important as well. And then the cheek teeth, so these big ones back here are your premolars and molars. Sometimes they can get overgrown, like if a tooth is missing or cracked, they can get really tall. And obviously, if you've got a tall tooth sticking up, it means that horse can't grind properly, which is also a problem. So then we know that if your mouth hurts, you're probably not going to feel very well. You might be grumpy, and horses can get grumpy if their mouth hurts, and they can also not behave themselves very well. So you put a bit in their mouth and you're asking them to turn around that barrel or go to that fence and jump, and it hurts, and you're pulling a little bit on their mouth with the bit and the bridle, and things are sharp, you may have a horse that doesn't want to go. It may be fighting the bit and shaking its head around. You might see them dropping grain when they're eating. Those are all reasons to have your veterinarian do a dental exam. And then in older horses, sometimes horses will choke. So if their mouth is really bad, they can't grind their teeth very well. Maybe they're getting really old and their teeth are getting super smooth, or they're missing some teeth. And so they get a little packed up here like a chipmunk, and they don't grind their teeth properly when they swallow. They can get that food caught in their esophagus and choke. So anytime we have to go out on a horse that's choking as an emergency, we always check their teeth to make sure that's not part of the problem. And then obviously, if your mouth hurts, you're not going to eat very well. So we sometimes have to look at horses that have gotten kind of skinny over a couple of months. We'll check their mouth and make sure it's not because they've got something wrong with the tooth. So just a few pictures here. This is the inside of a horse's mouth, and I promise you they go back forever, it seems like. So this is the tongue, and this is the roof of the mouth. It has these funny little like lines or rolls or wrinkles on it. They would swallow back here. So that's the back of the throat, like way back here. And this is the cheek. It's the right cheek. So these are their upper teeth. And when we look at them, you can see these white points, and those are the enamel points that are normal. They don't look really, really sharp, but if you ran your finger on them, you would find that they're pretty sharp. And what they do is they tear up the cheek, and then it turns kind of blackish brown and yucky, in part because they don't brush their teeth and partly because they eat plants. And so sometimes the plants will stain the ulcers in their mouth, but this is actually all ground up little holes in their cheek. So if you can think about that, those of you that have had braces and you get those sores in your mouth from braces, that's kind of what this is like. This is the same sort of picture. So I apparently like to take pictures from this angle. Here are two huge ulcers at the way back of the mouth. Again, all these little sharp points. And so when we get in there with our dental equipment, we can smooth those points down and make them a lot more comfortable. We also see overgrown teeth. So sometimes if a horse has not been to the dentist in quite a while, so they haven't seen their veterinarian, and we open their mouth, we might see a point like this. Can you guys imagine how painful that would be if that top point is digging into the gum down here? And it causes some cuts in the mouth as well. And the same thing, sometimes at the back of the mouth, we'll see these wicket points, and they can go up. We've actually seen horses where they're up into the sinuses or up into the back of the mouth, and they're cutting way up high because they get so tall. And then there's a big ulcer here from all of this. And so once we get in there with our equipment, we can make these horses a lot more comfortable by correcting all of that so that they don't have problems. Okay, any questions on my brief, not hour-long dentistry lecture? Nope. Okay. So I found this slide a couple years ago. I do a lecture for the third-year vets on basically on poop. I mean, poop's really important if you own horses, right? If you have to clean the stall, you have to clean the poop out. So we have to get rid of the poop. It's important to know that your horse did poop. And if you're a veterinarian, we're always asking about poop. My kids think it's the most disgusting thing ever because I always want to know about the poop. Or I have my arm getting poop which is not pleasant either. And they think that's disgusting too. But I saw this slide about poopology, which is not really a word, but somebody decided to make this up. And it's the art and science of reading and managing horse poop. And if you have horses, you got to manage the poop. So when we're talking about managing the poop from a veterinarian perspective, we really want to get a fecal egg count. So what is the fecal egg count? Because that sounds kind of gross, and really it is. And it starts here with your horse giving you a nice present of poop. And what do you do with it? I should have put pictures in here because people bring them here and they drop them off at the large animal hospital for us. And we get these notes from our receptionists that say poop in the fridge because it'll come in Ziploc bags. Sometimes the entire pile comes in a great big freezer gallon size bag. We don't need that much or this much. But anyway, we take this and we take a tiny, tiny bit of poop, mix it with a special solution, and we look at it under our microscope and we can actually see the eggs. So if your horse has worms inside its intestines, we will find the eggs. And we usually see strongid eggs or strongyle eggs. They're the most common. Sometimes we see ascarids, and then these get counted. So we actually mostly send these to the lab because I don't think I have time to count lots of eggs and lots of poop. And right now we're doing spring vaccines. So we're seeing like 25 to 40 horses a day. That's a lot of poop. Like we fill a big trash bag full of all these little bags of poop, and then we put it in the back seat with the students and we get it back to the vet school, and then we take it to the lab. So what do we do with the fecal egg count? Why do we care? Why do we care about those numbers and poop? Well, partly because horses can have a lot of different types of intestinal parasites. Most commonly these days are the strongyles, tapeworms, and ascarids, which are those fuzzy little round eggs that you saw. If your horse has a lot of intestinal parasites, they can cause problems. So we can see colic or diarrhea, which is not pleasant. In young horses, sometimes they'll be really fuzzy. They've got kind of a big belly and they might be small for their age. So your friend might come over and be like, how old's that horse? And you say, oh, she's 6 months, but she really looks like she's 2 months. Babies often have a lot of worms. And if you have young horses on your farm, they can give those young horse worms to older horses. We also see sometimes people be like, my horse just is not as energetic as it used to be. It doesn't want to run. And we do a fecal count and we're like, oh, well, that probably is part of the problem. Like there's parasites inside that are stealing some of your horse's energy and making them feel not very good. And we always check when we've got a horse that's losing weight again. So those are the big things with weight loss in horses, is what's going on. Are they getting their groceries? And is everything coming out normally? We also care because not all horses handle intestinal parasites equally, and not all dewormers work the same. So it's important to give the right dewormer for the kind of parasites you have. And the other thing is that maybe I've been doing this about 20 years. So 10, maybe even 8 years ago, we would say, just bring us a sample from a couple horses in your field. We'll run the fecal egg count and we'll come up with a plan. What we know now is just like if all of us went and played with 2-year-olds for a day, some of us would get sick because 2-year-olds tend to be in daycare and have lots of germs running around. I have 3 kids. I know all about this. But horses are, not everybody would get sick, and not all horses have high fecal egg counts. So what we've really learned over the last couple of years is that if you have 10 horses in your field and you bring us a fresh poop sample, or we go out and collect it for every horse, most of the horses in a well-managed situation are going to have almost no parasites seen. And a couple horses might have a small number, and you might have one horse that has a really high number of intestinal parasites. And that horse needs to be treated differently. It maybe needs to be dewormed more often. It needs to be separated. We need to figure out if it's got resistance, so the dewormer just doesn't work. That's part of why we do this, because that one horse that maybe looks fine, but is pooping out worms or eggs like crazy, that horse is exposing all the other horses in the pasture to those worms and potentially making everybody else sick. So once we have an egg count, like 25 eggs per gram of feces or 500 eggs per gram of feces. We had one come back at 1,400 eggs per gram of feces the other day. He's getting old and I think he's got a metabolic disease. So I think he just can't fight off the worms like he should be able to and like he used to. But what we decide then is, when are we going to deworm your horse? How often? What should we use? Does that dewormer work? And if we had a really high egg count and we have you deworm, then we're going to want to check again in 30 days and make sure that number is really low and that it worked. So that's kind of the scoop with fecal egg counts. And we have to talk about it because I'm a vet and we have to talk about poop always. Poop's very important. Okay, so this is my segue. Yes, look at you nodding over there. It is very important. We always want to know about poop. Okay, so we're going to talk very quickly on just a couple of slides about equine infectious anemia and the Coggins test. So equine infectious anemia is another nasty virus that horses can get, but we don't see it very much in this country, thank goodness, but it still does exist. It's spread by biting horseflies. So they bite your horse and steal some blood, and then they go bite another horse and they spit some of your horse's blood into the other horse, and then that's how it spreads. And some horses can get sick and die from it, and some horses will get better and they'll act completely normal. But if you don't know they had the disease and they don't die from it, they're still carrying that virus in their blood. So now they look fine, but a biting fly can come and spread it around, and there's no vaccine. So we do what's called a Coggins test, where we take some blood from your horse here, just into a nice red top tube. We take it with a special piece of paper that has a description of your horse. Nowadays we use pictures. So we take a picture of each side of your horse in front of your horse, and then we have to note, does your horse have a sock or a stocking? Does it have a star or a blaze? That all goes into the paperwork, and your veterinarian has to be federally accredited because this is a big deal. And then when it comes back with a negative test, you have this nice piece of paper that says your horse was negative and all is well. And then you can go to wherever you need to go. So if you wanted to go down to a big barrel race at C, which is in southern Indiana, you would need a negative Coggins test. And if I wanted to go take my wild beast I haven't been on forever to Come Again Farm at the end of the month and try to take him over a bunch of jumps, which wouldn't be very smart. But if I wanted to, I would need to make sure I had a Coggins test, because that farm owner won't let me on her property without a negative test. Some boarding facilities in our area, and probably all throughout Indiana, require a test every year. And of course, sale barns and auctions often require a negative test. And then anytime we have a horse come in here that's sick with anemia, so they don't have enough red blood cells, we will test them as well, just to make sure that's not what's going on. And like I said earlier, there's been talk that this might become a 4-H requirement. I think if it were to become a national requirement, we could get rid of it and it would never be an issue again, but there's no way to make sure everybody actually does their testing. So currently it's not required unless you like to go across state lines. So if you want to go to Gordyville and go to the Quarter Horse Congress and show over there with your horse, or you like to go trail riding in Illinois, which I've only been once, but there's some cool trails over there. If you wanted to do that, you should have a negative Coggins test to go across state lines. Okay, this is me, and this is my daughter, who decided she didn't want anything to do with my lovely English riding, and she has turned into a crazy contesting person. All right, so back to showing. We're going to do our little biosecurity briefing. This is what we all want, right? We want a row of healthy, happy horses. It would be really nice to come home with a bunch of champion halters and ribbons. I'm always happy to come home without having fallen off my horse, but those are my goals. Our biosecurity goals, we want to keep your horse safe. So if you go to an open show, or if you go to the 4-H fair with your horse, you don't want your horse to get sick there. And you don't want your horse to come home and get everybody else at your barn sick. Maybe you want to go to state fair afterwards. You need to keep your horse safe and healthy. So our goal with biosecurity is we want to prevent the spread of contagious diseases. And the big ones we talk about, again, are those respiratory ones, which are equine influenza and equine rhinopneumonitis. Strangles, which does have a vaccine. It is not required by 4-H, and we have some barns that vaccinate every horse for strangles, and we have some barns that don't vaccinate, and some barns check the amount of antibodies in the blood. It all depends on the barn or the horse owner, but that is another big one to think about. Salmonella is a GI bug, so it is a bacteria that sometimes horses will have in their poop, and it can spread to other horses. It's not super common. And then really nasty lice and mites, which we also occasionally see spread from horse to horse, but typically if your horse and your friends' horses are going to a show, ideally you are grooming them and brushing them and taking good care of them, and you're not going to see lice or mites. So a couple key points. I will just tell you that I started doing a biosecurity lecture here at Purdue maybe 12 or 13 years ago, and I found this on the web. I have no idea where, so I can't credit it. I've always wondered what on earth is going on with that poor little pony. I mean, the pony looks worried, but what is going on with the pony that they have two people that are completely covered? I mean, this is a full biosecurity suit, like radiation or something. But it makes me think of that, like, we don't want that to happen. So that's a great picture to have in mind when you're thinking about biosecurity. So some key points: vaccinate your horses. Let's keep everybody safe. If your horse is vaccinated, it's not going to get sick. And then the horses it's around shouldn't get sick. And if your horse is sick, I know it's terrible, but if you think your horse isn't right, or it's got a little cough or a snotty nose, and there's a big show this weekend, you should maybe get your vet out, and you should maybe consider not going to the show, because it would really stink if you brought your horse to the show, your horse got a bunch of other horses sick, and maybe your horse got so sick that it couldn't show anyway. So if your horse is sick, you got to keep it at home, even though none of us want to give up on showing. If there is a disease outbreak, which happens periodically, there's been one in southern Indiana right now. There was one maybe 8 or 10 years ago at the Cutting Horse National Finals. That was a huge deal because those horses in Texas went everywhere after the finals, and they took the disease everywhere. So if horses get really sick, sometimes they can also die. So we don't want to have that happen. And if the facility gets sick, so like say my friend's barn gets strangles, she's gonna have to close. Like, no horses in, no horses out, no shows until everybody's better and a veterinarian said it's okay. Your horse might get stuck someplace where you don't want it to be stuck because it can't leave. You can't take a sick horse home to your own horses. So that's always a problem. And then you might not be able to go across state lines. So every once in a while we'll have a disease in horses that there'll be an outbreak. Oftentimes then Kentucky will say, nope, no horses from Indiana can come down here until this is all taken care of. And that might be terrible if you don't have a thoroughbred racehorse and you're not going to a breeding farm. You are actually going to go to a nice jumping show, but you can't travel because there's been an outbreak. So common sense, like, this does not have to be full suit gowns, everything really crazy. We can be really smart about biosecurity for our horses at shows. There's going to be horses you don't know. So if you're like me, my kids like to stable with their friends. So those horses all end up kind of together. And because they're their friends, I'm the friend's vet. So I know the horses have been taken care of properly, and I'm comfortable with all of that. But there's lots of people I don't know, and there's lots of horses I don't know. And they may be from another part of Indiana where they have a little bit different environment or bacteria or viruses. So this is a bad idea. And I go horseback riding periodically. There's a trail riding that I go to, and they have troughs like this filled, which is great because we want to keep our horses hydrated. But it's not great because if any of these horses are not well and they've got their nose down and they're drinking and they happen to have a little bit of snot come out and get in the water, and another horse were to drink that, which is really disgusting, they can get sick just that simply from this. And another thing, how often do you go to a horse show and somebody comes up and says, I forgot my water bucket. Can I borrow your water bucket and give my horse some water? That's a hard thing because horses need water, and you don't want this person's horse to get sick and colic because it's not got any water. I have a spare bucket in my trailer that I take everywhere. And if I need to loan somebody a water bucket, it's not the water bucket I'm watering my horses with, because it's so simple just to think about not exposing them that way. So then we have things like the end of the hose. If you go to a show, you might see that people come with their water buckets and they dunk the hose down in the bottom of the water bucket, and they fill it up and then they take it out and somebody else dunks that in their water bucket for their horse. Anything that's in the water bucket can get on the hose and go to the next bucket. So coming along with disinfecting wipes and cleaning off the end of the hose, advising visitors, don't touch the horses. I mean, we don't want them to get bit. We don't want them to get hurt. We don't want them to give our horses something that might make our horses sick. And we really don't want them to go from this stall, pet this horse on the nose, to this stall, pet this horse on the nose, to this stall, pet this horse on the nose. And while we're doing that, we're taking all the germs from this horse to this horse to this horse. That would be like walking into a daycare with one Kleenex and wiping this horse or this kid's nose, and then this kid could blow their nose, and then this one uses the same tissue. So keeping people from touching your horses is sometimes hard, but really good. And then hand sanitizer out. Just, I mean, we currently live in a situation where hand sanitizer, washing our hands, those things are all second nature now. And having wipes around is second nature as well. Really, when you're thinking about horse shows, it's important to do that too. Not because of COVID, but because of everything that horses can get. Some people get really aggressive about stripping out the old bedding from the show stall. The barn I like to go show at, she prefers that you strip the bedding out when you leave, and then you come in with fresh bedding. And depending on the show and what was there before, and if I know that there's been sickness, you can spray the walls with a bleach disinfectant. But for most people, that's getting a little bit crazy, so we don't do it very often.
Dr. Farr, we do have a question in the chat
Sure.
about the strangles.
Okay.
That they had heard that strangles vaccines were recommended mostly for young horses, but older horses probably didn't really need it anymore.
So that's probably true. There are 2 strangles vaccines. I'm not sure if the intramuscular is currently available. There is an intranasal, which is really awful from a veterinarian standpoint, because we have to take this long, skinny straw and stick it up a horse's nose and then squirt the vaccine up there too. They don't like that very well, but the vaccine does work. It is a good vaccine. And what we know about strangles is that yes, most horses are going to get exposed to horses that have a low grade infection and aren't actually sick. And so young horses are definitely at high risk because they've got baby immune systems. So maybe up to 4, maybe even 6 years of age, I would say, depending on what you're doing with your horse, it's not a bad idea. One of the interesting things that we're starting, and this is an area of a lot of research right now, and they update, there's this like 30-page document on strangles that gets documented or updated every couple of years. It's not a very exciting read, but it's full of really interesting information. One thing they're finding is that we can pull blood on horses and look at their antibodies for strangles. And if their antibodies are really high and we vaccinate them, they can actually get really sick with a different form of the disease. So if there's been a strangles outbreak in the barn in the last couple of years, we don't like to go in and vaccinate anymore because that's a risk. And so we check their titers. And we've got some older horses who, I mean, they maintain protective titers every year. Unfortunately, it costs more to check the titer than it does to give the vaccine. So sometimes that's a hard concept for clients to think about. Like, I'm going to spend $120 to see if my horse needs the vaccine, or I'm going to spend $25 and just give the vaccine. But there are some concerns with over vaccinating for strangles in older horses. I don't know if that answered the question. I definitely would worry about it more in younger horses. Okay, and then I just made this because I thought this was kind of funny, and sometimes I have too much playtime with my PowerPoint. So here are 2 horses, maybe at a nice show, and they're like snorting and sniffing each other the way horses like to do. And so there's this nice bay horse that's come to the show, and it's actually shedding an upper respiratory virus, but it's not showing any signs. So they brought it because it didn't look sick, and people don't always know, right? You don't always see sickness until several days after they've started shedding or being contagious. So then your nice bay horse says hello to the nice paint horse. And now the nice paint horse just got exposed through all those sniffly droplets when they were sniffing noses. So your big question is, will your nice paint horse get infected? It's this simple. And so if we have vaccinated, then ideally that answer to our question is no, our horse isn't going to get sick because it was vaccinated. And again, that goes back to why vaccines are so important. And biosecurity is simple. If you don't know that horse, maybe they shouldn't be sniffing noses anyway, and it should be staying away from each other. And then here's my daughter running home, betraying me from my lovely eventing world on her horse. This was a number of years ago. She's not nearly so tiny, but so you've run home, you're done. You get to go home. Are you really done? No, you're not done. You still get to do some biosecurity. So you should keep an eye on your horse's appetite and make sure they're drinking. And oh, what's that? You gotta check their poop. Make sure they're pooping. Make sure their poop is normal. Make sure they don't get diarrhea. Make sure there's actually poop in the stall. And then depending on how big the show was, like if you go to the Quarter Horse Congress, there are bazillions of horses there. That's a huge deal. And there's a huge risk of exposure. So maybe when you come home from that, you should put your horse in a stall or its own paddock for a couple of weeks and keep it away from everybody else, just in case it picked something up. So it doesn't make everybody else at the barn or your farm sick. And it's kind of a pain, but checking the temperature every day is great because often the temperature will spike before your horse starts showing any other signs of sickness. And we recommend 2 weeks, but again, most people don't do that for a 4-H show, and frequently they're going from show to show to show every weekend. So just keeping an eye on it. The other big thing you can do, and if it's possible, we really recommend that for a lot of our show barns, is the horses that are actively showing and traveling, they're in one pasture and they're stabled at one end of the barn. And then your mares, your brood mares, your babies, they're elsewhere and they're stabled and pastured separately. So that at a minimum, your horses that go out and play with other horses, they don't come home and potentially infect other horses that aren't going anywhere. Okay, questions on that one? Yes, ma'am.
So if you are showing every week and it's like back-to-back shows, do you recommend just checking the temp every day throughout your show season? Because like
if you're showing that much,
there's not a time that I'm home like 2 weeks solid. You know, I'm always going to the next show. So
good for you.
No, well, before college, but
oh, well, yeah, life happens sometimes.
Yeah.
So yes, ideally, again, that horse should not be going out with the general population. If you go to a show Friday and you come home Sunday and then you leave Thursday for a different show and then you come home Monday and then you leave Saturday and you come home Sunday, don't put that horse out with everybody. I mean, that's why separating horses for pastures and things like that helps. And yes, it's a great idea if you could take their temperature every day, because that will tell you if they're starting to get sick. And frequently before you start seeing a snotty nose or a cough or a little bit of depression or swollen lymph node, you're going to see an elevated temperature.
Thank you.
You're welcome. Okay, so this is my fun part here. Some of you, I bet, have accident-prone horses. I have clients who have accident-prone horses. Like if someone's going to call me about a bump or a lump or a cut or a bruise or a lame horse, I have some horses that I swear just like to torment their owners. And I know these owners want to bubble wrap them. They would like to run to the office store, get all their bubble wrap up their horse, and then hope that that doesn't cause any more problems. But unfortunately, we cannot bubble wrap our horses, and we can do some things to try to keep them from injuring themselves. So we can try. Like, look at this. I had a friend send me this. I don't even know how this happened, but this is a great hay feeder. It is smooth. It is round. I don't see any sharp corners. And there's this nice net in here so that they're not spreading their hay everywhere and then pooping on it and then eating it. And I have no idea. That's a great hay feeder. I have had to sedate horses and get a Sawzall and cut them out of metal feeders 3 times now in 20 years. This is super. How did this horse get in the middle of his hay feeder? I have no idea. But there are things we can do to try to keep these silly creatures safe. One of them is to remember that horses are flight animals, so they are prey, and that means they're going to spook, and they're big and fast. Racehorses can run over 30 miles an hour, and so you have a 1,000-pound animal that can go really fast, and they are clearly athletic because, again, I have no idea how that horse got in there, but it seems to be okay, so it must have done it well. And like we showed you with the picture with the skunk and the horses, they're inquisitive, they're kind of nosy, and sometimes they put their noses where they shouldn't, or they take their entire body in. Years ago, I was trying to go to a horse show early in the morning. It was dark and my horse was being very stubborn about loading on the trailer, and I was very frustrated, and I was up all by myself. And so I took him around to the front of the house and stretched out my lead rope to open my front door and bellow for my husband to come and help me load my horse. And he walked into the house with me. I could not get him on my trailer, but he came right in the front door to see what was happening in the house. And that just proves they are inquisitive, and that gets them in trouble. And then some horses are claustrophobic, and so if they get kind of in a squished down area, they may panic and bolt. And we also have to remember that their brains are tiny. Like my little fist is the average horse brain. So that great big horse head has a little bitty brain in it that reacts pretty quickly. They don't have a lot of common sense, and they have the mentality action before thought. So they're going to bolt and dump you on the ground, end up 10 feet away, and then look back at you like, what is going on? Why are you on the ground back there? As opposed to thinking first. With that said, we can think about safety in the barn. So decluttering your barn aisle. If you're like me, I get tired and sometimes the buckets get stacked up and the blanket gets ripped and I get mad and I kind of throw it in a pile over against that wall. And then those silly bale twine, sometimes I just pick them all up and put them in a pile over here. And my barn aisle gets really cluttered. And then horses can get stuck in that stuff or bump it, knock a bucket over, and startle. It's also important to have a secure place for your feed because a couple of reasons. One, we don't want any mice to get in your feed, and we don't want possums in there because they can carry other diseases. So keeping your feed like in a freezer or something safe and secure is really important. And then we also don't want, if you've got a talented horse that can escape a stall, we don't want your horse to escape the stall and suddenly they can get into the feed, they eat 20 pounds of grain, and you're having to call your veterinarian because they're going to colic or their feet are going to get sore with laminitis. Also avoiding tight spaces and sharp turns, like when you're plotting where you're going to put stalls in your barns or particular cabinets or anything like that. Because again, if a horse spooks in a tight area, they can squash you and they may run. And thinking about safe flooring, so non-slip mats, things like that, because we don't want them to slip or fall down. And safe stalls. So solid walls are really nice because horses cannot get their legs stuck through them. Broken boards cause lacerations, and those gaps along the bottom, every once in a while we have a horse get their foot stuck between the bottom of the stall and the ground in that little area. Fencing safety. We can do an entire lecture on fencing safety, but one thing to think about is what kind of fence do you have? Do you have a wood fence? Wood fences are pretty good. They can break and cut your horse, but really they're pretty good. And I'm a huge fan of coated high tensile. So if you have 4 or 6 strands and it is actually properly coated high tensile wire, it kind of acts as a barrier. They'll bounce off of it rather than get stuck in it. And then there's like impact flex fencing, which the idea is to give. There is woven wire, which is great unless your fence post breaks. And then apparently the electric was off too because we had a horse go right over this fence and tear up its chest. And that was actually my horse, and I never walked that corner of the fence line. So I felt really dumb and took a picture to put it in the lecture to remind everybody it's important to patrol your fence lines. That's actually what I did on Saturday afternoon. It was nice and warm and I went for a walk around my fence lines, found some things I want to fix. So is your fencing safe? Can you make it safer? And then whether it's safe or not, walking around it and making sure you haven't got a post broken, you don't have connectors down, you don't have a wire down, the deer haven't gone through. The deer rip my fencing up all the time. I wish they would just jump over it, but it seems like they go through it, and I'm always replacing connectors out in the back. So those are some things with fencing. And then safety in the pasture. There's obviously lots of things like trees or poisonous plants that we could spend more time talking about. But one thing we see is creeks and ponds. Can they be fenced off? Do they provide a source of water all year? Do you need to have access to them? Are they going to flood or turn into mud lots or become a freezing hazard where a horse might walk out on the ice and then break through? So this is one of my friend's horses. They had a really lovely lake about 20 years ago that has pretty much slowly but steadily dried up. 2 years ago, we had a ton of rain, and their little itty bitty lake turned into almost a sinkhole of mud. And one of their old mares they found in the morning, she got stuck out there overnight. She was exhausted and she was buried in the mud. We have been using old fire hoses and other straps, but old fire hoses make great straps. With the tractor, they got her drug out of the mud, and as soon as the weather improved, they decided that they didn't need anybody to have access to their little mud hole. And so those aren't things we think about until that happens to somebody. And then you're like, maybe we need to make sure they can't get access to that. So, and it's really important in my opinion, because they have babies out there every once in a while. So they've done a great job. There's wood posts alternating with a couple of T-posts and woven wire and a hot wire. So nobody's going to get stuck in the pond again. I am a huge NCIS fan. So for those of you parents that watch things like that, a BOLO means be on the lookout. So I'm putting BOLOs out for other hazards, things you guys should be looking around your property for to make sure that they're not hazards that don't get your veterinarian to have to come out. Believe it or not, the old fashioned big hole, thick twine that doesn't break hay nets can be quite a hazard. We've seen a number of horses get stuck in them. This was a first though. Actually, this happened at Robin Ridgway's barn with one of her boarders, and she's going to talk to you guys next month about trailer safety. She's amazing. So she is a light sleeper, thank goodness. She also has her house close enough to the barn. She heard this horse get stuck. I have no idea how he got stuck, but the bottom back part of his shoe got stuck in his hay net. I don't know if he was rolling or stretching or got cast, but you can see he literally has beat up the wall trying to get loose. So she heard the ruckus, came out, was able to safely cut him loose from his hay net, and he didn't have any issues. He wasn't lame. He didn't have any cuts or bruises. They did have to get the farrier out to actually take the shoe off because the hay net was jammed underneath there so tightly that they couldn't get the rest of the hay net out. But the newer hay nets that have much smaller holes, so horses don't get a leg stuck in them, are a lot better. Plus they're better for them to eat slowly, so we like those. Another thing to have a BOLO out, bucket hooks. These are the nemesis of veterinarians. This is a carabiner, and look how easy that is. You can just kind of push this little bit in with your thumb, lift your bucket off, go fill it, rinse it, clean it, whatever, and bring it back. Same thing here. That's one of those push snaps. And then these, that's a double-headed thumb snap. And I use these all the time, but all of them are facing out. This one does not close properly. Anytime a horse comes and puts its head down in the bucket, it risks hooking an eyelid or any other part of the face. So this needs to go in the trash. This one and this one just need to get turned around so the clip faces away. It's a lot less convenient when you're doing buckets, but we see a lot of these. So this is an eyelid laceration. Sometimes we end up with a scratch on the cornea, but this horse literally put his head down to drink. This came up under the upper eyelid, and when the horse pulled back, it literally ripped the eyelid loose. I didn't put the fixed pictures in them because they were pretty bloody, but we can usually fix those. But I mean, that's an emergency call and time and money and anxiety wasted. So when you guys go out to your barns tomorrow, you can look and see if any of your bucket hooks need to be turned around. Loose nails. My technician is a longtime horse person, and over the years I've gotten to do this too. But when I first started, I always thought it was funny because while he's holding a horse and we're vaccinating or doing teeth, he is chatting and also looking around the stall. and he sees things like this. And then sometimes he'll even go get a hammer and just take care of them while we're there so that the owner doesn't forget. Because these are, I mean, nails work their way out and we don't think about it. I have to do this in my stalls because things get away from me. But little nails sticking out that have worked their way out, believe it or not, this is kind of gory, but it healed up really great. This whole lip got torn open from a horse going down into a feed bucket that had just a tiny little nail that had backed out. So it's kind of incredible how destructive they can be. And then just random sharps. This was a really cool, the mare that lives in this stall likes to kick the wall a lot. And so they installed this sprayer thing. So when she kicked the wall, it sprayed water at her with the idea that she'd stop kicking the wall. And eventually she kicked the sprayer and broke it. So they took it down. But when we came for spring vaccines, this part was still left up. So those sharp things are still pointing into the stall, right where she might come over, put her head up against those rails to look out and, you know, see what's going on and get herself ripped open on those. Same thing here. This is a little high. You can see there's a water bucket down here, but that doesn't mean horses don't raise their heads up, and they're not tall to begin with. So look up when you're looking around for things that need to be removed. Same thing here. We try to get these bolts cut off just because a horse might put its head here and be itching its pole along the edge of this and literally rip the side of its face open. And again, the same thing here. A bunch of horses all come racing to the fence when you come out. They come sliding in, slide up against the fence and get poked in the leg with this. So again, just walk around when you're walking your fence, when you're looking at your pastures, your barn, your stalls, just try to look for sharp things. So while we're talking about sharp things or emergencies that you might need to call your veterinarian for, do I have time to keep going? Okay. So I want you guys to know some normal physical exam parameters. So these things are kind of important. And so heart rate, you can buy a fairly cheap stethoscope and keep that and listen to their heart kind of here on the side. The left side's the easiest. You can also sometimes put your fingers against their face by their eye. They've got a nice artery here, so you can hold that down. We consider a normal heart rate to be somewhere between 24 and 48 beats a minute. Remember, the bigger the animal, the slower the heart rate should be. So my heart rate usually sits about 90. I am definitely not as big as a horse, and none of us are hummingbirds who have these incredibly fast heart rates. If your horse is not acting right and you get a heart rate of 60 or 80 beats per minute, you need to call your veterinarian because that's not normal. The same thing with the respiratory rate. I mean, obviously after they've exercised or run, their heart rate's going to be up, the respiratory rate's going to be up, but they shouldn't stay up. And if you come out there and your horse is breathing really hard, like 40 or 60 breaths per minute, like this, you need to get your veterinarian out there. And then the lovely rectal temperature, most horses are good for this, not all horses, and their normal does run higher than ours. So if we had a temp of 101.5, we would probably consider that we have a fever. Most horses, 101.5 isn't anything to get really excited about. We do take it rectally. You just need a regular, cheap digital thermometer. My kids make me write rectal on every thermometer, and they will not let me do an oral temperature on any of them. We have to do armpits because none of them believe that there are thermometers in the house that have not taken a temperature this way. There are, but in any case, simple, basic thermometer, you can get a temperature. We've had a very weird, we think it's a virus, nobody really knows, but we've had a weird disease going around the last 9 months or so where we have horses that are randomly spiking fevers. One of my colleagues saw one today that had a temp of 104. So that's a good reason to call your veterinarian. You can, especially if you have either good ears. I have clients who they'll be like, I listen to the gut sounds, and they'll demonstrate how they just put their ear right up against their horse's belly. And honestly, sometimes that works, and stethoscopes work too, but we recommend listening kind of up and down and right and left. There should be a little bit of noise, rumbly noise on all 4 areas. And if there's not, and maybe there's not poop, and maybe the heart rate's a little bit elevated, that's a good reason to call your veterinarian. And if your horse will let you, we like to look at membranes. So basically we're looking at the gum. It should be anywhere from a pale pink to a pink, brick red, purple, those are all bad. And it should be moist. So just like if you check your own gum, it's a little bit slimy here. If it's dry or if it's sticky, those are also things to tell your veterinarian because those aren't normal. So when should you call your veterinarian? If there's a fever, so your horse isn't right and you take its temperature and it's greater than 102, that might be a good reason. Or like we talked about, elevated heart rate, elevated respiratory rate. If your horse is acting colicky, so it's rolling or pawing, biting or looking back at its flank. If you come out and your horse is holding a leg up like ouch and it won't walk, or it's really lame when it is trying to walk, that's probably an emergency. Horses that are down and can't get up, that's usually an emergency, especially if it's cold or if it's really hot. So don't wait too long. We can do a lot better job of saving horses that are down for some reason if we see them within the first 6 to 12 hours as opposed to 3 days later. Most lacerations, you probably need to at least be able to send a picture to your veterinarian. So if they're over a joint or if they seem really deep or there's a lot of blood, when in doubt, reach out to your veterinarian. And then all these other things too, you should probably call your veterinarian about. Anything to do with an eyeball. They only have 2 and they're kind of important. And horses have really nasty bacteria that live perfectly happily in their eyeballs, in the sac here around the eye. But if they get scratched or they get banged and bumped, sometimes those bacteria will go a little bit crazy and take over the eyeball, and that's not good. So if you come out and your horse's eye is really squinty, or there's a lot of tears coming down, or it's kind of swollen shut, or you look at it and it's kind of blue or cloudy, you should call your veterinarian, because don't let the sun set on an eyeball. They're important and we want to get them seen. And then if you come out in the morning, like one of you kids comes out and there's no poop to clean, you should go back in and tell your mom or your dad that there's no poop in the stall and go out and look at your horse, because no poop is not good, because we worry about poop. And then if they're not eating, or if they're choking, or if they're wobbly and not walking right, or stumbling and falling when they're walking, or signs of respiratory infection, those are all good reasons to call your vet. Basically, if it's something new, it's unusual, it's unexplained, or it makes you scared, you should call your vet. And these days, like Purdue's got texting, which I love, and I do one day a week at a small animal clinic. We just got texting there too. It's awesome. Like people can send me pictures and I can say, hey, oh my gosh, yeah, we need to see this. Or no, I don't think I need to see that. I think you should try this and let's touch base tomorrow. It's amazing because we don't waste clients' money on things that don't need to be seen, but we also can make sure that we see things soon if it does need to be seen. And that's, I don't know, I think it's exciting. I love new technology like that. Okay, so if you have an emergency, don't panic. If people are panicking around you, like screaming and carrying on or being all dramatic, just send them away. They don't need to be there. They aren't going to help. And you need to remember to stay safe. So your super kind horse that you can crawl underneath and pick up the legs and roll all over, if it is hurt or doesn't feel well, it may not act the same. So just take your time and be careful around your horse. So if something doesn't seem right, assess your horse, call your vet. If you have insurance, you should call your insurance company. Not very many of us have horse insurance. I have maybe 5% of my clients that have horse insurance. I do not have insurance on any of my horses. I should, but I don't. So, but if you do, you want to call them and say, hey, we got a problem. When you call your vet and you're waiting for them to call back, because that's how a lot of this works, be available. Don't like leave your phone in a stall and go back outside. Don't call your best friend and start sending them pictures and not be able to answer the phone. Don't call multiple veterinarians, because that's very frustrating from a veterinarian standpoint. And sometimes there are 2 or 3 emergencies that come in at once. And so I want to help everybody, but I don't want to try to be helping somebody that's got another vet coming too when I could be helping somebody else. Try to accurately describe your problem, be patient, trust your veterinarian. And if you don't have a trailer, not everybody can afford a trailer. Not everybody's truck works all the time. I just squashed my Suburban a couple weeks ago, so I would need to call a friend. So have a friend lined up for a trailer, because maybe it's bad enough that your veterinarian is going to say, look, we need to think about referral and you should go someplace. And if you don't have a trailer and your vet comes out and says, this really would be better in a hospital, now you may be spending an hour or 2 trying to find somebody with a trailer, and your horse really needs to be going to the hospital. So that's, I guess that's an important point to me. Make sure you've got a trailer lined up. And then lastly, an emergency kit. So I think everybody should have some sort of an emergency kit. I actually have, these are like what I use. I have a tackle box that I keep all kinds of interesting things in here. And then I have a tote that I keep everything that doesn't want to fit in my tackle box. And they are labeled in big letters so that they are easily identifiable. If you are putting pressure on a wound and you need to tell your friend that's visiting or your spouse that doesn't do anything with horses or one of your kids, I need you to go get my emergency kit. It's here. And it looks like having it be labeled really clearly is great, because maybe you don't want to take time away from your horse. You need to be with your horse. So it needs to be easy to clean, because unfortunately barns are dusty, poopy, and sometimes emergencies are bloody. And it needs to be easy to transport. So that's why I keep mine in two. This is all bandage material basically. So if I'm dealing with a colic, I don't get my bandage material. And I also don't have all of this in a giant tote that I can't carry. One thing that's nice to keep inside part of your emergency kit is a little Ziploc bag that has your veterinarian's numbers. Some of this was more important before we had cell phones. So, you know, you called your veterinarian and then you had to stay in the house by the phone and wait for the phone to ring. And you might have to look up the phone number in the yellow pages, try to find how to get a hold of these people. Nowadays, most of that's in your phone. But if it's not, it's nice to have it in a little Ziploc bag. And again, some people have horse haulers or friends that are going to help them. So that's a good number to have too. And then this is everything I think you should try to have in your emergency kit. And it's a lot. And I will just say stethoscopes are nice, and you do not need a $200 one or even a $100 one. But if you have horses, or if you have accident prone horses or princess horses that like to have little colic episodes, having a stethoscope is good. Having a simple digital thermometer is good. Again, label it for rectal or horse or whatever you want to put on there. Flashlights are always good, and that goes along with over here a headlamp, because if I'm out in the barn with help, I'm going to give somebody a flashlight so I can look at something really closely like a wound. But if I'm out there all by myself, I want to be able to strap a headlamp on. I may look like a miner, but by golly, I'm going to be able to see while I'm working on this horse. So those are both helpful. Scissors are great. Exam gloves are great. Some bandage material is helpful. Vet wrap is the stretchy stuff that kind of holds everything in place. We use a lot of diapers. Diapers go around funny shaped legs. Diapers go around feet. They're cheap. You can get generic diapers. They don't have to be anything fancy. Usually size 4 to 6 work great. And maxi pads, I know, are a weird thing to have in there, but they're so absorbent. So if you've got a lot of bleeding, you can stuff a maxi pad up against there and it will help absorb, and you can apply some pressure that way. And then if you do have to put a bandage on, having a non-stick wound pad, so you can get those at CVS and they're not very expensive. And I think a sharp knife is good, because if your horse is stuck in a hay net or their halter, like I had a little filly who I didn't put her rope halter on tight enough, and she put her hoof and front leg through it. And I found her out in the pasture in the dark, standing down by the ground. She was really smart. She didn't fight, but I was really glad I had a knife in my pocket. So, and the same thing with a wire cutter or a multi-purpose tool. If you have a horse down in a fence and you can grab your emergency kit, it's really nice to have something like that. And then all of these basics like mild soap to clean things. We keep Ivory or Dawn dish soap around. Clean towels. These are all my rags that get shredded. I just cut up towels and everything else and put them in there nice and clean. Duct tape. You can't live without duct tape. We can duct tape just about anything back together. So you need duct tape. Elasticon is not a bad thing. Antibiotic ointment. I keep a Walmart brand contact solution, you know, the $2.50 bottle, not the $16 bottle. I can rinse out eyes with that. I can rinse out wounds with it. And then again, if you're comfortable doing leg wraps, having some leg wraps around, keeping a hoof pick around. Some clients like to have a 60cc syringe around, which is the big one that you can really get some pressure to squirt and kind of clean things out. And a lot of my clients keep a tube of bute or Banamine around, because they may have a colicking horse and they'll call and say, hey, my horse is colicking, can you head this way, but I'm 30 minutes away from you? And I'll say, yeah, give a dose of Banamine, please, and I'm on my way. So depending on your relationship with your vet, that's also nice to have. And I know that's a lot of information, but for all of you 4-Hers and parents, this is my daughter and her best 4-H friend a couple of years ago after they had their contesting and had painted their horses. It's all about the friendships and the healthy animals. So do you guys have any questions? Hopefully I didn't overwhelm everybody.
So somebody did have a question earlier. Emma had a question that wasn't specific about the topic, but she wanted to know if you enjoy being an equine veterinarian.
I do. I do a lecture for the undergrads on careers in equine veterinary medicine, and it is a tough field right now for a lot of reasons, but I would not change what I do, even though I get beat up and I'm kind of sore most of the time. And I don't have time to ride my own horse, which is kind of sad, but I wouldn't change it. I love it. I love working on these horses.
Super.
Well, I'm not seeing any more questions, but to allow you guys to reflect on everything Dr. Farr has said tonight, you can either put this in the chat or think about it on your own. What is the first thing that you plan to do to improve your horse's health management?